Well, artificial intelligence is certainly transforming healthcare, but with that innovation comes some serious questions about accuracy and trust. Dr. Essam Hamza is CEO of Rocket Doctor AI. He's leading a new approach to AI in healthcare, one designed to help bridge the gap between providers and patients. And with that, we say good morning to Dr. Hamza.
Yeah. Good morning, Ken.
Good morning. So the I guess AI is a two-edged sword, right? It could really help us, but there's always that fear and that lack of trust that people have, especially in the beginning. So at this point, how is AI helping to improve the interaction between patients and providers?
Yeah, and you hit the nail on the head initially when you said it's about trust. Trust is really the most important thing right now when you talk about healthcare and in particular AI. You should always ask where they're getting the information from, how accurate it is. And, I always implore people to not accept something that says that they are 70% accurate. You would never go to your doctor or specialist and be okay with the lab test being only 70% accurate. And so it is very important when we talk about healthcare that it is very, very accurate. The second part is how is it helping? Is it just a one way street and only helping the healthcare system or the doctor? Or is it actually helping the patient as well? And this is what we really focus on is about trust, accuracy, and how to improve efficiency and reduce costs and improve accuracy, improve care.
And that's amazing because once you get it up and running and people start to trust it, the idea that they quote unquote make busy work that would otherwise take individuals a long time to sit down with a patient and try to figure out
Yeah.
what healthcare is best for them, et cetera. The fact that a computer can look at 1,000 variables and figure it all out, that's going to be amazing. And I guess it's sort of there now, right? So, but there's still growing concern, I guess, about AI systems that so-called hallucinate. So what does that mean that they hallucinate? Is it that they take all sorts of information and they don't know which is good and which is bad? What's that about?
Yeah, that's exactly it. It's garbage in, garbage out. So historically, when we thought about AI, we thought about the chat GPTs of the world and so on. And the question is, these are generative large language models, and where do they get their information from? And historically, they've been scraping the internet for good or bad information, and they are forced in their algorithm to kind of give you an answer one way or another. And sometimes that leads to either inaccurate information or hallucinations, or sometimes the answer is different each time. With our system, it is not based on a large language model or an outside system. It's a proprietary system that we have, always accurate, always getting the same response, created by doctors for doctors, tested and tried and true. Used by medical schools right now for their medical students and testing their clinical skills and so on. So the trust part of it is really important because you can't afford any hallucinations or any inaccuracies there. And so that is the number one thing you always talk about. And then the second part is how is it helping? What parts of it is really helping the healthcare system? And some of the numbers I can give you is that we're spending over $5 trillion in healthcare right now. It's not about spending more money in healthcare. It's about the inefficiencies. If a doctor is spending 40% of their time on paperwork, admin work, if a patient is frustrated on a Sunday night because their kids are sick and their only options to talk to anybody is either go to emergency room or go to ChatGPT, what can you do? And so imagine a 24/7 nurse, an AI nurse, talking to you at any time at all, checking, seeing how you're doing, onboarding you, triaging you, helping the doctor in the diagnosis as well as the whether you should go for blood work or not ahead of the appointment, and then following up with you or your child as well after the appointments to see how you're doing with the antibiotic, if there's any reactions, and so on. And so the idea of using AI in healthcare is not something that is theoretical anymore. It is practical. It's happening. And the question again is always going to be about trust and accuracy and what does it mean for the overall system. But the main part of it is don't spend more money in a healthcare system that's already using a lot of money.
And yeah, and doctor, I'm even thinking about new parents who might not have the best judgment yet and say, for every little thing, they're terrified and they bring their child, they rush their child to the emergency room where AI might be able to help and say, no, 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 just a little Tylenol and the child will be okay. It'll get the fever down, blah, blah. The fever doesn't come down in 2 hours, then go. Something like that, that kind of a judgment call that may help parents to allure their fears and not allure, but the word I'm looking for, to assuage their fears, and to help, obviously help the child. And then also, if the child has an infection, that helps prevent the spread of infection. You don't unnecessarily take the child into an ER, or if not necessary. And you said that large language models aren't used for clinical judgment. So what does that mean?
Yeah, so large language models are what we call generative AI. They script the internet for good or bad information. They present information to you as if it's accurate, and then they keep learning from the inputs coming back in. And the problem with that is it can be contaminated. It can be contaminated with bad information, and so you'll see this a lot of times in the news where some program like ChatGPT or others has started saying things it shouldn't say, either is hallucinating or becoming racist, or giving answers that are completely inaccurate. And it's because it's trying to think of an answer, and sometimes the information coming in that it was trained on is made it inaccurate. And so in healthcare, you can't have that, and that's the hallucinations we talk about. So those are large language models. In our system, it's a library, what we call Global Library of Medicine, that we created ourselves. It draws from this very accurate information that's always updated, and it can always be trustworthy. And that's kind of where I think the world is moving towards, is especially in healthcare. You can use the large language models for natural speech. Like, for instance, in our system and others, you can talk to it in any language you want. It understands what you're saying. You can change the voice and so on. And that's great. But where is it getting the information? Where is the brain for the healthcare information? And that's what we're talking about with kind of our system.
I love it. Doctor, we're down to about 10 seconds. What is a website for more information?
Yeah, so it's rocketdoctor.ai, and if you're in New York, you can actually see one of the doctors on our platform, and that is rocketdoctor.io. And we cover, like I said, most patients on Medicare, Medicaid, and all the top 10 insurers in the state as well, and across in California.
Awesome. Dr. Essam Hamza, CEO of Rocket Doctor AI, thanks for coming on this morning. We're coming right back.
Thank you.